Assalamualaikum warahmatullahi wabarakatuh. My name is ATIERAH SHAHIDA binti AHMAD NAZOL. My magic number is S66389. Today, I want to present my industrial training report where I'm doing my internship at Inframedic Sendirian Berhad. Background of organization. Inframedic Sendirian Berhad was incorporated on 15 July 2019 and this company is a private medical clinic that known as Klinik Perubatan Wildan Batu Rakit. The clinic is located in the medium high density suburb of Kuala Nerus, namely Batu Rakit. Klinik Perubatan Wildan already have 10 branch where the new branch that they open is in Jelawat. The company have one warehouse located in the same building as Klinik Perubatan Wildan Batu Rakit, and the company has one OEM and ODM factory based on research and laboratory analysis that is GMP, which is Good Manufacturing Practice and Halal certified by JAKIM. Next, SWOT analysis. One of the main strengths of Inframedic Sendirian Berhad is the strong support from management. This ensures that the clinic's operations run smoothly and that staff receive guidance whenever needed. Management actively monitors patient feedback and address any complaints to maintain high service quality. They also consider the welfare of both employees and patients when making decisions. Additionally, management encourages staff development by providing training and opportunities to improve skills. Regular performance reviews are conducted to identify improvement and address any challenge. Overall, the management is approachable, listen to problems, and work on finding solutions. Another strength of Inframedic Sendirian Berhad is having a clear policies and guidelines for all staff, whether it is management or operation staff. This policy explains what employees need to do and follow, which helps prevent misunderstanding and reduce misconduct. Clear guidelines also promote discipline among employees and ensures that everyone's action align with the company objective. One of the weaknesses of Inframedic Sendirian Berhad is there are no an official technician. Currently, when technical problems occur, such as computer or system issues, staff have to try to fix them by themselves. This can disrupt their main task, especially during the peak hour when quick access to patient records is essential. Without technical expertise, problem solving takes longer and may lead to additional costs. Having an experienced technician would improve system efficiency and provide a long-term solution for smooth clinic operations. Next, manual updating doctor schedule. The clinic uses Microsoft Excel to manage duty schedule, which are shared with staff and patients through social media. However, there are always last-minute adjustments such as doctor substitution or shift adjustment that are not always communicated immediately. Even with the Google Excel, there is a lack of consistent monitoring after the schedule is shared. This can lead to the confusion among both patients and staff. Another weakness is the limited marketing equipment. Currently, the marketing team uses a single smartphone to both record and edit video content for the clinic's TikTok. This affects productivity and time management, especially when multiple marketing activities are planned simultaneously. Sharing one device can also reduce content quality. Providing additional equipment will improve workflow and allow the team to produce higher quality content more efficiently. One of the opportunities for Inframedic Sendirian Berhad is collaboration with local influencers. The clinic has partnered with popular influencers in Terengganu such as Abang Crunch and Abang Zeki. These collaborations include sharing sessions with content creators from different branches, focusing on increasing engagement through niche-specific content. Other activities include joint events like a three-corner football match and sponsorship of the Equine Fun Run on 18 October. Inframedic also work with influencer YBI Nachongek to promote the Batu Rakit branch. These collaborations help increase marketing reach and strengthen the clinic's brand presence in the local community. Another opportunity for Inframedic Sendirian Berhad is becoming the official health partner of Terengganu Football Club, or known as TFC. Through this partnership, the clinic gains visibility among fans and the general public by participating in promotional activities such as giving away Klinik Perubatan Wildan X TFC jerseys, free match tickets and burgers during football events. This not only boosts marketing but also promotes health awareness through sports and builds a positive brand image. Overall, the partnership increases the clinic's market reach and positions it as trusted healthcare provider in Terengganu. One of the threats faced by Inframedic Sendirian Berhad is the presence of many competitors. These include private clinics such as Klinik Ihsan, Klinik Aina Asma, Klinik Azlina, and nearby government health clinic like Klinik Kesihatan Batu Rakit. Many patients prefer government clinics due to lower consultation fees and medicine subsidies, where they only need to pay RM1 during registration. This creates a challenge for Inframedic to maintain patients' number and remain competitive in the healthcare market. Another threat faced by Inframedic Sendirian Berhad is economic instability. Rising living costs may lead patients to reduce expenses and prefer government clinics, even if it means longer waiting times. Economic instability can also increase medicine price, causing patients to pay higher treatment costs at private clinics like Inframedic. Next, there are a few systems that Inframedic Sendirian Berhad need to improve. The first system is Internet and Network Connectivity System. The problem is Inframedic Sendirian Berhad sometimes experience internet network disruption, which will disrupt daily operations such as updating patient records, online meeting, and digital marketing tasks. So, the proposed solution is Inframedic Sendirian Berhad should consider upgrading the internet plan to a high bandwidth so that it can accommodate access used by multiple users more efficiently. And the implications is it can improve network stability and reduce downtime. It can ensure smooth access for multiple users at the same time, and it can enhance efficiency in daily operations and online activities. So this is the flowchart of System 1 before improvement and after improvement. The second system is Patient Flow Management System. The problem is during peak hours, the waiting time for patients to get treatment becomes longer. This happens because there are limited consultation rooms and the number of doctors available at that time. For example, during the influenza epidemic, there are so many patients, but there are no space for the patients during their waiting time. So, the proposed solution is Inframedic Sendirian Berhad can build a system where patients can see available times and make appointments online. When patients have made an appointment in advance, so they can receive an estimate of the time they need to wait to receive the treatment. And the implications is it can reduce patient waiting time during peak hours, improve patient satisfaction and overall experience. It also can help staff manage patient flow more efficiently and reduce overcrowding at the clinic and improve service quality. And this is the flowchart of System 2 before the improvement and after improvement. Next one is the third system, which is Doctor Scheduling and Communication System. The clinic use an Excel file to update the doctor's duty schedule. However, the schedule is sometimes modified after it has been published by the marketing department on the Facebook page. This causes inconsistency between the actual duty schedule and the public schedule, which may confuse patients and affect the clinic's image. So, the proposed solution is the clinic should implement a final verification step before any schedule is published online. The person in charge PIC should be designated to confirm and approve the doctor's duty schedule before it is shared publicly. And the implications is it can ensure consistency between internal schedule and public information, refuse patient confusion regarding doctor's availability, and improve coordination between administration and marketing departments. And this is the flowchart of System 3 before the improvement and after improvement. There are a few experience and skills that I have learned during the industrial training. The first skill is video production and digital content design in the department marketing. I learned how to develop content scripts based on healthcare topics, especially when they are currently issues regarding the health. I also learned how to conduct video shooting for social media platforms. I also learned how to apply proper camera angles, lighting, and body language. I also learned how to edit perfectly the videos using the CapCut and Canva. Also learned how to design the posters following clinic branding guidelines. And I managed to make a daily content posting schedules. The second skills is make an ads claim memo in the marketing department. In these skills, I learned how to prepare advertising claim memos for Facebook ads and TikTok ads. I also learned how to record advertising costs and additional charge accurately. Then I will verify the total amounts to ensure consistency with actual ad expense. And I also manage and update reference number on a monthly basis to ensure proper documentation and minimize formatting errors. The third skills is communication skills, where these skills I learn in all departments. I learn how to communicate effectively with management staff, clinic assistant, and resident doctors, where I practice conveying information clearly with a polite and professional attitude. I'm also participated in daily stand-up meeting, which is known as Weeboost, to share knowledge and ideas. And everyone will take turns to conduct the stand-up meeting. Because of the stand-up meeting, I gained so much confidence in speaking and leading discussions in a professional settings that can help me enhance interpersonal communication and teamwork skills. However, there are also a few problems that are encountered during the industrial training. The first one is time management. I need to balance the time to balance multiple tasks such as video content creation, poster design, and ad claim memos within tight deadlines, especially when the due date is in the same day. The second one is difficulty accessing company data or system. This is because the limited or restricted access to company database and software affected workflow and delayed task completion. The third one is communication challenge. This initial difficulty in conveying information clearly and confidently to staff and senior management. This is because there are always miscommunication happens between all the departments. So the conclusion is, I gain exposure to a real work environment at Inframedik Sendirian Berhad. I also learn important skills such as discipline, time management, teamwork, and effective communication. I also understood how each department contributes to the clinic's success. I've also managed to identify the areas for improvement, including doctor scheduling, patient waiting times, and internet connectivity. I've also developed problem-solving skills and the ability to adapt to challenge. And I got the benefit from guidance and support provided by management and clinic staff. And this is the few features during my industrial training. So that's all from me. Thank you.